Contact dermatitis is a skin rash that appears after the skin touches something that irritates it or triggers an allergy. It can look red, itchy, and sometimes form blisters. Allergic type occurs when the immune system reacts. Irritant type occurs when the skin is damaged by a harsh substance. The causes are split into two groups. Allergic, substances like nickel in jewelry, poison ivy, latex gloves, or certain cosmetics. The skin's immune cells recognize the substance as a threat and launch a reaction. Irritant, chemicals such as detergents, solvents, strong soaps, or even prolonged water exposure that physically damage the skin barrier. The damage itself causes inflammation without involving the immune system. Red or pink patches that may spread beyond the area that touched the irritant. Itching, burning, or stinging sensations. Dry, scaly patches or tiny bumps. In severe cases, fluid-filled blisters that may ooze. Example, after washing dishes with a harsh detergent, you might notice itchy red spots on your hands that appear a few hours later. Doctors diagnose it by looking at the rash and asking about recent exposures. They may do a patch test for allergic dermatitis, where tiny amounts of common allergens are taped to the skin for 48 hours to see if a reaction occurs. Treatment steps: remove the offending substance immediately. Cleanse the area gently with mild soap and water. Apply topical corticosteroid creams, for example hydrocortisone, to reduce inflammation. Use moisturizers to restore the skin barrier. For severe itching, oral antihistamines can help. If the rash is widespread or does not improve, a doctor may prescribe stronger steroids or oral medications. Identify and avoid known triggers. Read product labels. Choose hypoallergic jewelry. Wear gloves when using chemicals. Wear protective gear, such as nitrile gloves, instead of latex when handling cleaners. Keep skin moisturized daily to keep the barrier strong. Rinse skin promptly after contact with potential irritants and wash with gentle soap. Do a patch test at home with a small amount of a new product on a hidden skin area before full use. Development of new low irritant surfactants for cleaners that cause less skin damage. Research on biologic drugs, for example dupilumab, originally used for eczema, showing promise in severe allergic contact dermatitis. Better in vitro testing methods that can predict allergic potential of chemicals without